Inflammation. Definition: body defense reaction, local response to eliminate or limit the spread of injurious agent, illness, others foreign substances, or. Protective mechanism of body involving host cells, blood vessels, proteins and other mediators to remove the injurious stimuli. or. Complex biological response of vascular tissue against the harmful stimuli like pathogen, damages cells or irritants. Followed by removed of necrotic cells and tissues resulting from the original damage and initiate the repair process. While doing that, inflammatory response and subsequent repair process can also cause significant harm. If triggered or directed inappropriately, inflammatory response can itself become harmful, leading to cell, tissue and organ destruction. Host defense cells and molecules, such as leukocytes and plasma proteins, typically circulate in the blood, and goal of inflammation is to direct them to the site of infection or tissue damage. Inflammation is not the synonyms of infection, but sometimes inflammation is caused by infections. Etiology: physical agents, mechanical injuries, external harm, alteration in temperature and pressure. Chemical agents or radiation effects, list of drugs and toxins, exposure to radiation. Biological agents, pathogens, infections, germs such as bacteria, virus, fungi. Parasites. Immunologic disorders, hypersensitivity reaction, autoimmunity, immune deficiency state, etc. Genetic, metabolic disorders, gout, diabetes mellitus, etc. Inert materials, foreign bodies. Signs and symptoms. 5 clinical sign of inflammation. Rubor, redness, increased blood flow due to dilatation, wider of small blood vessels in damaged area. Calor, heat, elevated temperature due to increased blood flow to area, hyperemia, and metabolic activity. Tumor, swelling, accumulation of fluid in the tissue or extracellular space, edema. Loss of function, function lesa, impaired function of the inflamed area. Movement bindered, etc. Dolor, pain, stretching, distortion of tissue from edema, chemical mediators can induce pain, sensitivity, discomfort due to the release of chemicals that stimulate nerve endings. Classification of inflammation: acute inflammation, chronic inflammation. Acute inflammation. It is the immune system's response to a sudden injury or illness. Inflammatory cells rush to the site of injury, such cut or damage, or infection, initiating the healing process. Various infections can trigger sudden, typically short-lived, inflammation. Acute inflammation may last from a few days depending on the condition or severity of damage or cut or infection. It is a good inflammation. A serious threat triggers the inflammation, a cut, bruise, infection, etc. The body releases inflammatory components. Once the killing of bacteria and clear of debris is done, body releases anti-inflammatory components are released, then body goes back to normal as usual. It is an immediate or quick response to sudden body damage. It is beneficial for body and provide protection response against injury, e.g., fever, pain, redness, swelling, etc. Duration: short-term response that typically lasts a few days to a few weeks. Causes triggered by an injury, infection or allergic reaction. Purpose: to eliminate the cause of injurious agent or infection and to initiate the healing process. Symptoms of acute inflammation: discolored or flushed skin, mild pain or tenderness localized to the injury site, swelling, e.g., inflamed knee, skin that feels hot to the touch, difficulty using the affected part of body normally, e.g., reduced range of motion. Pathogenesis of acute inflammation. It involves 2 steps. Vascular events and cellular events: migration of WBCs, leukocytes, rolling and adhesion, emigration, chemotaxis, phagocytosis. It mainly involves in recognition of injurious agents, pattern recognition receptors PRRs, complement system, recruitment of inflammatory cells, vascular changes, cellular events: rolling, pavementing, adhesion, transmigration, diapedesis, activation and elimination of the pathogen or debris, phagocytosis, release of inflammatory mediators, oxidative burst, resolution of inflammation, removal of the stimulus, anti-inflammatory mediators, apoptosis of neutrophils, tissue repair. Vascular events: tissue injury to release of chemical for local effects, histamine, prostaglandins, kinins, leukotrienes, complement, etc. to immediate response is vascular contraction. It may persist for 3 to 5 seconds or last for 5 minutes depending on the severity of injury, known as transient vasoconstriction. To after this phase arterioles get dilate, known as persistent progressive vasodilation. To it increase the blood flow, and this type of vascular expansion produce redness and heat, known as erythema. 2. When the volume of blood flow increase, it increase intravascular hydrostatic pressure. So fluid from the capillary get migrate into the tissue, and this fluid is known as transidate. To when the volume of blood flow may raise more and permeability gets increases, fluid with the protein migrate from capillary to tissue, known as exudates. To loss of protein-rich fluid from capillary reduces the intravascular osmotic pressure and increase the osmotic pressure of interstitial fluid present into the tissue due to migration from capillary, greater than. So it produces outflow of the water and ions into extravascular. These fluids accumulations into the extravascular space and produce edema. Cellular events occurs in 2 process. Leukocytes, WBC, movement process, and phagocytosis. Migration of WBCs to tissue injury to produce vasodilation due to increase the volume of blood flow to. So permeability of capillary get increased and fluid, plasma, get moved from capillary to tissue to plasma, or fluid gets discharged from the capillary, so the ratio of WBCs and RBCs get increased plasma discharge due to exudate, known as migration to, so it increases the viscosity. The leukocyte roll on the endothelial of capillary to the leukocyte on their surface consists integrin protein, and endothelial cell of blood capillary consists selectin protein on their surface, E-selectin and P-selectin, greater than. During the leukocyte rolling on the endothelial cell, integrin and selectin get activated and produce adhesion of leukocytes on endothelial cell of capillary. To after the adhesion or sticking leukocyte moves into extravascular space from the gap between endothelial cells or from the capillary, this phenomenon is known as emigration to its site of injury. Several mediators get released which attract the leukocyte. This kind of mediators at a site of injury known as chemokines, histamines, leukotrienes, platelet activating factors, prostaglandins, cytokines, complementary protein, etc. And attraction process of the leukocyte towards injury is known as chemotaxis process. Phagocytosis. The process of killing or engulfing of solid particle or agent, engulfment of foreign particles, bacteria, virus, by WBCs, leukocytes, is known as phagocytosis, means cell eating. The process performed by phagocyte involves various steps: identification, recognition, and attachment. At the site of injury, several chemotactic factor get released from the infected bacteria. The attracts the phagocytic cells, WBCs. It identifies or recognizes the microorganism at the site of injury and coat the microorganism by opsonin proteins, which are naturally occurring substance from the serum, and it gives help for the attachment of phagocyte to microorganism. Engulfment. Now the phagocyte is ready to engulf the microorganisms. The PSU-DO pods present on the surface of leukocytes wrap the foreign particles and engulf them, and the new structure formed is known as phagosome. Degranulations. After the engulfment, phagocyte release the lysosome, the degradating enzyme. Digestions or degradations. These degradating enzymes kill the microorganism and digest it. However, this mechanism gets failed to kill bacteria like Mycobacterium tuberculosis, or the phagososme fuses with lysosome and forms phagolysosme, and after that lysosomal enzymes released inside phagolysosme which kills and digests the bacteria. Chronic inflammation. It occurs when body continues to send inflammatory cells even in the absence of a clear threat. For example, in rheumatoid arthritis, inflammatory cells and substances attack joint tissues, causing inflammation that can fluctuate and potentially lead to severe joint damage. In chronic inflammation, the body's protective processes can actually cause harm. This type of inflammation can persist for months or years, with periods of improvement and worsening. It's a bad inflammation, non-serious event triggers inflammation, eating a certain food, acne bacteria, etc. The body release inflammatory components. The body doesn't release anti-inflammatory compounds and keeps sending an inflammatory response. E.g., asthma, Alzheimer's disease, peptic ulcer, etc. Duration. Long-term response when causative agents of acute inflammation remains for a longer duration, that can last for months or even years. Cause triggered by persistent infections, autoimmune disorders, exposure to toxins, or lifestyle factors such as obesity and chronic stress. Purpose not necessary beneficial and can contribute to the development of various chronic disease. Symptoms of chronic inflammation: abdominal pain, chest pain, fatigue and/or insomnia, fever, joint pain or stiffness, mouth sores, skin rash, depression, anxiety and other mood disorders. Gastrointestinal issues such as diarrhea, constipation and acid reflux. Weight gain or weight loss. Frequent infections. Pathogenesis of chronic inflammation. When acute phase cannot be resolved, persistent injury or infection, prolonged toxic agent exposure, autoimmune disease states, repeated acute inflammations to activates the mononuclear cell like phagocyte, tissue macrophages and circulating monocytes, and lymphoid cells to get migrate towards injured area, engulf the microorganism to digestion of microorganism or their particle release bacterial endotoxin or various cytokines. It stimulate the immune response against the dead microbes or death cells to it activates the T cells, activated T cell, CD4+, release lymphokinase IL-I, IL-2, growth factors IEN square root and TNF-alpha to it produces tissue injury and inflammation or fibrosis.